First question, which phenomenon is based on wave optics? Option A, laser. Option B, scattering of light. Option C, interference. And option D, absorption of light. Correct answer for the question is option C, interference. Second question, image formed by prism is option A, virtual. Option B, erect. Option C, displacement toward apex. And option D, above all. Correct answer for the question is option D, above all. Third question, highly refractive surface of eye is option A, lens. Option B, cornea. Option C, aqueous humor. And option D, retina. Correct answer for the question is option B, cornea. Fourth question, the line joining the fixation point, nodal point and the fovea is called option A, optical axis. Option B, visual axis. Option C, fixation axis. And option D, pupillary line. Correct answer for the question is option B, visual axis. Next question, negative angle kappa results in option A, pseudo-exotropia. Option B, pseudo-esotropia. Option C, esotropia. And option D, exotropia. Correct answer for the question is option B, pseudo-esotropia. Next question, the line joining the fixation point and the center of rotation. Option A, optical axis. Option B, visual axis. Option C, fixation axis. And option D, pupillary line. Correct answer is option C, fixation axis. Seventh question, 1 mm flatter cornea will cause hypermetropia of option A, +3 diopter. Option B, +4 diopter. Option C, +5 diopter. And option D, +6 diopter. Correct answer is option D, +6 diopter. Eighth question, small eye, small cornea, shallow AC is signs of option A, myopia. Option B, hypermetropia. Option C, astigmatism. And option D, above all. Correct answer for the question is option B, hypermetropia. Next question, radius of curvature of anterior surface of accommodated eye is option A, 10 mm. Option B, 6 mm. Option C, 8 mm. And option D, 4 mm. Correct answer for the question is option B, 6 mm. 10th question, if a patient is hypermetropic, then his posterior focal point will be option A, behind the retina. Option B, before retina. Option C, behind lens. And option D, on retina. Correct answer for the question is option A, behind the retina. 11th question, an ability to change the focus of the eye is called option A, accommodation. Option B, anisometropia. Option C, ametropia. Option D, aniseikonia. Correct answer for the question is option A, accommodation. 12th question, a condition of unequal refraction of both eye is called option A, astigmatism. Option B, anisometropia. Option C, ametropia. And option D, aniseikonia. Correct option for the question is option B, anisometropia. 13th question, which is not a treatment of hypermetropia? Option A, optical treatment. Option B, surgical treatment. Option C, laser treatment. And option D, medicinal treatment. Correct answer is option D, medicinal treatment. 14th question, complications of progressive myopia are option A, retinal detachment. Option B, vitreous degeneration. Option C, posterior staphyloma. And option D, above all. Correct answer for the question is option D, above all. Moving to the 15th question, problem with the spectacles are option A, spherical and chromatic aberrations. Option B, decreased field of vision. Option C, cosmetic and weight. And option D, above all. Correct answer is option D, above all. 16th question. Commonest type of astigmatism is option A. Corneal curvatural astigmatism. Option B. Lenticular curvatural astigmatism. Option C. Index astigmatism. And option D. None of them. Correct option for the question is option A. Corneal curvatural astigmatism. Next question. In which condition parallel rays of light do not focus on the retina, rather forms focal line? Option A. Myopia. Option B. Hypermetropia. Option C. Astigmatism. And option D. Presbyopia. Correct answer is option C. Astigmatism. 18th question. A strongest prism with the base out will give the measure of option A. Convergence. Option B. Divergence. Option C. Both of them. And option D. None of them. Here the correct option is option A. Convergence. Next question. If an infant's corneal horizontal diameter is about 13 mm, condition is called option A. Microcornea. Option B. Megalocornea. Option C. Corneal ectasia. And option D. Corneal plana. Correct option for the question is option B. Megalocornea. Next question. Which bacteria is a common cause of purulent bacterial keratitis? Option A. Corynebacterium. Option B. Staphylococcus. Option C. Streptococcus. And option D. Aspergillus. The correct answer is option A. Corynebacterium. Next question. Scleritis is an inflammation of option A. Episclera. Option B. Sclera proper. Option C. Tennant's capsule. And option D. None of them. Correct answer for the question is option B. Sclera proper. Next question. Endothelial dusting is also a name of option A. Old keratic precipitates. Option B. Mutton fat keratic precipitates. Option C. Fine keratic precipitates. And option D. Medium keratic precipitates. Correct option D. Medium keratic precipitates. Next question. Which is a symptom of chronic uveitis? Option A. Redness. Option B. Photophobia. Option C. Lacrimation. And option D. None of them. Correct answer is option C. Lacrimation. Next question. Commonest cause of endogenous uveitis in India is option A. Tuberculosis. Option B. Leprosy. Option C. Syphilis. And option D. Diabetes mellitus. Correct answer is option A. Tuberculosis. Next question. In congenital cataract, opacity limited to option A. Embryonic nucleus. Option B. Infantile nucleus. Option C. Adult nucleus. And option D. Cortex. Correct option is option A. Embryonic nucleus. Next question. What will be the correct time to remove bilateral congenital dense cataract? Option A. Within 6 weeks of birth. Option B. Within 2 years of age. Option C. Within 6 years of age. And option D. 2 years to 3 years. Correct answer is option A. Within 6 weeks of birth. Next question. Age-related cataract is also called option A. Senile cataract. Option B. Congenital cataract. Option C. Traumatic cataract. And option D. Developmental cataract. Correct answer is option A. Senile cataract. Next question. Second sight is a result of option A. Cortical cataract. Option B. Nuclear sclerosis. Option C. IMSC. And option D. HMSC. Correct answer is option B. Nuclear sclerosis. Next question. Snowstorm cataract is due to option A. UV radiation. Option B. Trauma. Option C. Hypocalcemia. And option C. D. Diabetes. Correct answer is option D. Diabetes. Moving on to the last question. Question number 30. Rigid IOLs are made up of option A. PMMA. Option B. Silicon. option C hydrogel, and option D polymer. Correct option is option A PMMA. So please like, share and subscribe our videos. Thank you.